what dialysis is related to? People not managing their blood pressure. It has wear and tear on your kidneys, and now you need dialysis. And so because this is happening more frequently, people, they're just popping up everywhere. Every time I look up, there's another dialysis center. That should speak volumes to people in terms of your health. I know it can be rough to get up and exercise. I do it. It's overwhelming. You're tired, but that's something that is a necessity. You need to do it. You need to watch what you're eating so that you're not paying that money or taking your time to sit in these dialysis centers unnecessarily.
Amen.
Wow. I would say, in terms of like the dialysis, we got to ring the alarm, y'all, for Black people. Y'all, this does not have to be our story. Let's look at some stats, because I think people need to understand the gravity of what we're doing here. Studies show that Black households are more likely to have medical debt compared to white households. So 27% of us, 17% of them. In 2023, 27% of American adults skipped medical treatment because they could not afford it. Around 4 in 10 adults, 41% report having debt due to medical or dental bills in 2022. 2022, I filed bankruptcy so fast on that shit. Around 4 in 10 adults, about 36% of U.S. households have medical debt in 2024, and 21% had past due medical bills. And think about it again, the supply chain. All this money is going to the same people. It's greed. So people are dying in droves, especially Black people. When you look at everything medical wise, we're always at the top to die first, to have higher this, to have higher that. And we don't have to. So if your mama is on diabetes medicine, I'm not saying take her off. I'm saying talk to her about changing her diet. Talk to her about getting about that house. Talk to her about exercising. Talk to her about drinking more water. Talk to her about eating less fried foods. Like, those are things that can really make a huge difference, because what you do now, you're going to pay for it later. One way or another, it's coming to collect. They're coming to collect their money. And what you do is going to determine how much you pay.
Can I say real quick? And so I used to do home health. And like, I really care for people, right? And it doesn't matter who's watching me. And I would have these conversations, like, say, for instance, you have a patient that has congestive heart failure. Of course, you want to decrease your sodium because, you don't want to retain water. You're going to end up back in the hospital, all those things. And so I would have conversations with them. Now, these are people that have a long history of congestive heart failure. And I would say, hey, you seem that, have your legs are swelling, and I'm hearing fluid on your lungs. What's going on? What did you eat? Oh, I just had 2 Polishes. I don't add salt to nothing. I said, let's go to this kitchen. And I would go in the kitchen and I would show them the sodium intake on the package. They would have no idea. Oh, what did you have for dinner? I had Chinese food. So who's having these conversations? You have all these clinics, you have all these doctors, but because it's like a fast food restaurant, in and out. Nobody is really having these conversations. And sometimes it's not even the provider's fault, because at the end of the day, as a nurse, when I worked in the hospital, it was the worst thing for me. I would leave and dream and feel bad about all the things that I didn't do that had nothing to do with me. You giving me, I'm in a ICU and I'm taking care of 2 critically ill patients. Well, the person that's the sickest is going to get the most attention, and it has nothing to do with me. And I'm feeling horrible because of the way the system is set up. They overwhelm you. They have you taking care of a bunch of people.